Good afternoon, everyone. So, what I'm hoping to do today is talk about the ways in which people, citizens, us, can access easily now health information and move from information to knowledge in terms of looking after our own health insofar as we're able to do so. So, a bit about me. I'm the chair of the Professional Record Standards Body. There's a stand downstairs. Do come and say hello and find out about our work. I'm also Chief Medical Officer for Healthily, the self-care app and platform. So, more information about me. Well, yesterday I took 12,478 steps. That was 8.54 kilometres. Pretty good. I know. Actually, it was because I'd forgotten the post office had moved, so I went round in a big circle. But anyway, never mind. So partly due to that, I managed to burn 2,791 calories. So, I got up this morning at 7:03. I had 6 hours, 53 minutes of sleep, 59 minutes of deep sleep, etc., etc. Who cares? Well, who of you have got a device on your wrist? Fitbit, smartwatch, whatever. Maybe about a third, maybe a half. So, you care. You don't care about my stuff. But you care about your own, else you wouldn't have forked out 100 quid, up to 500 quid on one of these devices. Oh, good quiz, pub quiz question. When was the iPhone launched? 2007. Well, you go to the top of the class. So, none of this stuff we'd be able to do without smartphones. And, you know, you can forget sometimes just how recent this stuff is. I mean, I'm old, okay. So that's like, you know, that's hardly any time at all. But, you know, really, that is, you know, within 20 years, so 15 years, it's hardly any time at all. And the spread of the technology is phenomenal. So within 5 years, 80% of the world's population had a smartphone. It's now, the latest figure I could see is about 85%. So it reached sort of, you know, it sort of stabilised quite quickly. And I believe in the UK, the figure's about 83, 84%. So, you know, lots of people have got smartphones. And not just smartphones, but you know, all our devices. The explosion in the ability to access health information, and we'll all do it. Professor Google, or going to Healthline, Healthily, little plug. There's all these sites where you can get high quality medical information, health information written by professionals based on evidence. And actually, if you use search engines, the search engines will give you the sort of authoritative, or what they consider to be authoritative, but they will rank it so that if you're in the UK, for instance, you're likely to get NHS information at the top of your Google search. So, anyone can use their smartphone, their device, to access easily, instantly, high-quality health information. And then, as I've just been describing, it gets more personalised. So here we go with more Fitbit stuff. Other devices are available, but people can use it, the sort of things I was talking about. You get a stress management score. I'm not really too sure about that, actually, but it's there. The previous speakers were talking about monitoring the stress on various apps. Sleep, there's, you really get a lot of information about sleep, and actually we're getting much more evidence about how incredibly important good quality sleep is to general health. So this is the direction of travel, and I don't know where any of you in the audience where they were talking about blue boxes earlier on. So that's a briefcase-sized product that contains stuff for patients can measure their temperature, their PO2, 1 lead ECG, Can't remember what else is in it. Blood pressure. Okay, so this is it's a Withings smartwatch, and the reason I've shown this one as opposed to an Apple is that this is the first smartwatch to have SpO2 as a registered medical device in the US. FDA gave this medical device registration only at the end of last year. I don't believe any of the devices as yet in the UK or Europe have this registered as a medical device, but frankly, it won't be long. This one doesn't have blood pressure, but various smart devices do. I'm not yet aware of one incorporated into a smartwatch that's a medical device, but I do have, and I should have worn today, I forgot, I do have a wrist strap, half the width of this. It's an Actia one, it's a continuous blood pressure monitoring, and it's a grade 2 medical device in the EU. So basically, all this stuff is out there now or very soon. The blue box briefcase costs 600 quid. The Withings smartwatch costs 250, and I'm sure the price of that will fall. So, are we, the NHS, going to provide 600 quid bits of equipment, or are people going to use their smartphones, their devices, because they've got them, and are they going to get this information? You just have to think about that. And I think you have to think about what do we do about it. One of the features for marketing the smartwatch, oh, by the way, the Apple smartwatch, does anyone know when that was first launched? Got the Apple smartwatch? 2015. 2015 Apple smartwatch, and within 24 hours, it was the highest selling luxury watch in the world. Luxury watch being defined as one that costs $200 or more. So 24 hours to become the highest selling luxury watch in the world. But one of its main features that was certainly heavily marketed was the ECG app. And again, there's so what? What does that mean? And the big thing that people were talking about and were interested in is the ability for the app, indeed any of the smartwatches now virtually that have got this ECG function, the ability to pick up heart arrhythmias such as atrial fibrillation. I should say that the Apple smartwatch, the Apple smartwatch, this ECG function was not a medical device when it was first launched, but it is now everywhere, States, EU, here. And all the other functionality is rapidly progressing to medical device registration. So, what do we do with this? All these people using smartwatches and getting an alert that they've got a heart arrhythmia. What do you do with that? So this was a study where researchers in Stanford collaborated with people from Apple, and they did a huge study on cardiac arrhythmias in relation to the Apple Watch. I've put the bullets here. It was 400,000 participants. I will say, though, that the participants were people who owned Apple Watches. So it was quite heavily skewed to younger and wealthier people. But nonetheless, huge number of participants. They were also more male than female. So of this 400,000, 0.5% received notifications of an irregular pulse and then informed the research team. People who informed the research team about this notification of irregular pulse were then sent an ECG patch. And not everyone who was sent an ECG patch returned it, but about a third of people, sorry, I can't remember the actual number, but of those who returned the ECG patches, about a third were shown to have atrial fibrillation on the patch. So, interesting, but again, what do you do with that? We don't in this country, nor do we in the US, screen for atrial fibrillation. There is not yet the evidence that demonstrates that screening a population for atrial fibrillation will yield more benefit than harm. We don't know that yet. But this is just, it's happening. It's happening on a huge scale. And the same team, interestingly, continued the work, and they've just had another paper published in Circulation, which is another high-quality, high-impact journal. This one was just in October. And what they did was look at participants in the original Apple study who hadn't shown atrial fibrillation on their ECG patch. So the watch said atrial fibrillation, contacted the research team, got an ECG patch sent, 1/3 atrial fibrillation, 2/3 no atrial fibrillation. So what this study did was look at those 2/3 with no atrial fibrillation and followed them up, looked at further ECG patch data and discovered that around 40% of those had some other type of irregular pulse. And actually, again, in that group, around a third reported a later diagnosis of atrial fibrillation. For those of you who aren't medics, atrial fibrillation is important because it's a very major contributor to stroke and heart disease. So it's not nothing. But again, what do we do with it? Fascinating question. Well, I think it's fascinating anyway. So I've been talking about information, really, websites, going on to Fitbits, watches, smartwatches. That's all information. But information isn't knowledge, okay? So anyone can look up Google and read an article on atrial fibrillation, but they'll not know as much as me as a GP of 40 years' experience on looking after someone or what to do with atrial fibrillation. Information is not knowledge, but people can move in the direction of knowledge and inform decisions about their health. I just try to distinguish here a little bit the difference between information and knowledge. It is a continuum. With respect to health, we'd like to think as health professionals we're on the knowledge side of the continuum, but people do move along that continuum. So let's think what this means for patients, patients who have information and knowledge. So the self-directed patient, someone who has access to this information and knowledge. Increasingly, people will know and understand their baselines, their heart rate, respiratory rate, body temperature, PO2, sleep patterns, whatever. They may, and in fact probably will, have data from personal medical devices, Fitbit, smartwatch, whatever. And the sort of things that they'll have is information about their blood pressure, their blood oxygen levels. We already widely use information about blood glucose levels and in ECG, as I've already discussed. So we're talking about access to high-quality health information, access to apps, and being able to use the technology to understand when to seek professional help. So, for instance, in Healthily, what we try to tell people is the answer to the question, do I need to seek professional help, or is this something I can look after myself? So people increasingly with access to information and knowledge should be better able or be better supported to answer that question?
Am I able just to, if I wasn't doing my job properly, I'd just like to just advise you on if you're able to wrap up in the next couple of moments, just to bring the next fireside chat on to stage.
Sure. So
I don't want to stop you in your flow at all. I'm enjoying it immensely.
Right. Fine. I did start a little bit late, but in fact, 4 minutes. So, but just to flag up here, you know, I keep coming back to the so what. Okay, there are things we need to be careful here. There are potential major negatives from this stuff. You know, too much information, information overload. How do you pick what's important from all the other stuff out there? And I think we should be very concerned about overdiagnosis and too much medicine, treating people that don't need to be treated. But there's huge potential positives for individual people: control, autonomy, convenience. Again, we can think advantages, disadvantages for society. You know, if we are moving to a population who exercise more, better diet, better health, better mental health, healthier population, lower cost, you know, brilliant. But we also need to be careful about people who don't have smartwatches and apps and don't engage in this, you know. They're not living their best life according to other people. You know, we've got to be very careful you don't then start to, you know, despise people who don't go down that route. So, negatives and positives. So I am going to finish up. I will just say that this is the same child, by the way, so how close it can be, the negative and the positive. Challenges for general practice, actually, that's healthcare really. Can the apps be trusted? Is the regulatory framework fit for purpose? How do we link them to electronic records, etc., etc.? This is actually all happening, but we've got to be able to do it right and do it safely. And then I just wanted to mention the potential entry of big tech. So we here today have been talking, of course, about the NHS, etc., etc., but on a global terms, you know, there's other things out there, and I'll just flag this up to you. This is information from an article in Wall Street Journal in June on the Apple project to integrate their information from Apple devices into a healthcare system, which Apple did with their employees, which, by the way, was run by specialists and not by primary care doctors, and their employees were not necessarily delighted that their personal data was going to their employee-driven health service, and basically it's come to an end for now. Major questions were raised. The report from July says it's currently stalled, but who knows? Okay, there we go, finished.